This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the program. As always, a pleasure to have your company for the next hour, as we do every Sunday morning. Health Watch here, 8 till 9. Talk Radio 1210, WPHT. As you heard the man say, Dr. Molly FANTASIA is here as always. Dr. Molly, the PhD doctor, executive director and founder of Innovative Medical Associates, Marlton, New Jersey. We'll try to cover as much as we can in this hour. And, of course, we welcome your participation at 855-839-1210, 855-839-1210. That's our number here. If you have a question at any time for Dr. Molly, or you have a medical challenge you want to run by her, this is the time and this is the place, 855-839-1210. And as always, Dr. Molly, a pleasure to discuss what you do and how you help people.
Thanks, John. It's good to be here, and it's going to be a beautiful day today.
Yes, it is.
So I hope everybody's going out for their walk, or at least getting out a little bit after this whole year of being confined.
Yeah. Well, speaking of walking, thanks to you, your staff, and your physical therapist, I'm walking.
Good, and I'm glad to hear that.
So
and
we'll talk about that.
You're
right, a little bit later on.
Thank you.
Talk about Innovative Medical again this week. I know you had a consultation, and someone said, "Oh, we hear you on the radio all the time." And well, like what is this?
You know what, John? It is so difficult to really talk about what it is we are, but the long and short of it is that we are a primary care facility. So we have a facilities license, and we are primary care, and we are a collective, which means more than one. We are a collective of healthcare providers who share the same philosophy in that if you need conventional medicine, you need a drug, you need antibiotics, you need to be seen by the physician for a conventional problem, my goodness, we can do that. But we believe that there are many integrative processes that we can use to really help you reduce your need for pharmaceuticals, thereby improving your quality of life. Why do I say improving your quality of life? Have you seen the side effects on all these pharmaceuticals?
Oh, my.
Yeah, there's plenty of them.
And, we're on the weekend, and usually, we're watching TV at some point, especially in the wintertime, and all these drug commercials.
That's right.
And every one of them has the same pattern. They tell you about the drug, what it does, and then there's 30 seconds of, well, here's what it could do that could harm you.
And it's exactly right. So what we try to do is we're not going to say throw away your pharmaceuticals. We don't do that. What we want to say is let's see if we can reduce your doses or your frequency or some variation of that by using natural substances. And the most effective way to deliver those substances is through hydration.
Which is the cornerstone of your practice.
Right, it is. Not the only thing, but the cornerstone.
Right, and we're going to talk about many other things.
Sure.
But I wanted to ask you, because we were talking about the hydration.
Sure.
And we were talking about how it takes sometimes the place of pharmaceuticals.
It might.
Because of side effects.
Right, and
which
other
leads
things.
to the question, and I know people ask you this, with your hydration and with your natural substances, are there side effects to that?
Of course there can be. There can be side effects to anything we ingest. Let's not be crazy. So you need to use them appropriately, and you need to make sure that you are getting the best quality. And you and I both know you can go into the health food store and go through aisles and aisles of products. Right?
Yes.
Does it mean that, you're in the pain aisle, everything in that pain aisle is going to work for you?
No.
No. This is the problem. The problem is many times. Now, interestingly enough, I have a wonderful guy who's a patient of mine who owns a very well-respected health food store. Okay. Very well respected. And he's a brilliant guy. And he's smart enough to know that not everything he has in every aisle is good for every person.
Right.
But that's a rarity many times. You walk in, and I'm not disparaging health food stores. I believe health food and natural products have a lot of good qualities. but it's how you use them and making sure you deliver enough of the constituent that we want to give you that will actually stop whatever the challenge is or reduce this challenge in some way and continue your quality of life.
How many times have people come to you and they bring you bags and they say,
Oh, my goodness.
I went to the health food store,
That's
and
right.
you look at that and say, well, this does the same thing as that, and there's 5 things that they got that do the same thing.
Right. And you want to know a secret? Sometimes even people who are my patients for quite a while come to me and say, look at this list of stuff I'm taking. Can I get rid of some of it? You bet you can. As we move through our protocols, we're going to help you get rid of some of those on the list because you're not going to need them. The thing you are going to need is enough of certain constituents to maintain the quality of life as to where you are right now.
Best thing you can do is talk to your nurse barber,
Right.
who knows the layout of just about every
And
health food store.
also knows the layout of particular patients because she combs over the charts. Look, we spend a lot of time in our clinic looking at the charts. I mean, it is very, very important information that we get.
And the hydration, what's contained in the hydration,
Yes.
in the bags, as you like
Sure,
to say,
sure.
is protocols that are developed by you.
That is right. After 25 years in October, and I was lucky enough to have the most wonderful medical folks working with me through those 25 years.
And you came from a traditional.
I came from a traditional. We're
medical-
going to talk a little bit about that, a traditional laboratory background. So believe me, we are a uniquely positioned facility to help patients regardless, chronic conditions regardless. We can help you, but it is hydration that delivers the constituents to the patient in an appropriate amount for that patient. Just remember, not one size fits all. It's like having a customized suit.
That's right. And if you look in the clinic, like I've been getting a lot of orange bags, and
That's
I
right.
looked across the aisle, and there's somebody with a yellow bag,
That's
and
right.
somebody with a white bag, and I say,
right.
well, I know the answer to the question, so I don't ask it.
That's
but,
right.
But
Everybody's different.
the question always gets asked of you in initial consultations, and if people meet you through referrals, they always ask you, does this stuff work, Dr. Molly?
Well, I can tell you that in 25 years, I've seen improvement in quality of life almost in any type of chronic condition. And then I've also seen a particular change in patient in terms of their enjoyment of their life at this point. And that's really important.
And during the, and I'm glad it's over with, the COVID-19 crisis, and I remember we talked about this many times about vitamin C.
Exactly.
And how it helps you. And I never felt as though I was of course, everybody was vulnerable, but
Of course, we were all vulnerable.
I never felt that way because the vitamin C, kept
It
up
helped.
it helped.
Look, John, I often told you, don't be foolish, though. I
Right,
mean, we've
right.
got to use conventional methodology. You wore your mask.
Right.
I mean, come on. So we're not dumb.
Right.
But we do know that maintaining your particular immune system is the right way to go. And if you think that worked in COVID, it works in everything. If we have a strong enough immune system, what happens is on a cellular level, things are working properly. So, yeah, you have a little less vulnerability to what's outside. Makes sense.
Okay, we're coming up on our first break of the morning. Our show is Health Watch. We're here every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. And we're talking about, in general, the who, what, when, where, why, and how of Innovative Medical, what they do and how they do it. After the break, we're going to talk about some other things that they do, many other things that actually they do at Innovative Medical that you may not know about, and it's all part of helping you and your family improve your overall quality of life. That's the mission statement here on the show. 855-839-1210 is our number here in the studio. If you have a question for Dr. Molly, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Back here on Health Watch, and as always, when we're on the air, operators are standing by. at Innovative Medical Associates, and you can contact them. You say, I'm a little bashful, I don't want to go on the radio. That's okay. You can call the operators, and they'll help you out with whatever you need, whatever question you have. 856-489-0505 is the number, and that is the number all during the week for Innovative Medical Associates in Marlton, New Jersey. 856-489-0505. That's the number. And remember, the initial consultation with Dr. Molly is complimentary. You can also check out some information on the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And, of course, our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. Mark is in Belmar, New Jersey. Mark, good morning. You're on with Dr. Molly.
Hi, Mark. How are you?
Hey, good morning, Dr. Molly.
Good.
Is there anything that you can do with people with HIV?
You know what, Mark? The answer is yes. Yes.
Right.
Now, we can't cure it.
Right, of
you
course.
know, everybody's talking, they can't, but think about HIV as a virus, right? And think about all of the kinds of nutraceuticals. I'm sure anybody who, and God bless anybody who has HIV, who has this is following a good diet, right? Are you looking at antiviral foods, that kind of thing, Mark? Are
Absolutely,
they looking?
yeah. All that.
Oh, good.
I'm fine from it. I actually
Good.
There's no
Good.
problem with it, but I'm always looking to stay on top of it. You know what I mean?
You're right. You're exactly right. And you're just the kind of patient we would love to have come in and get tuned up from it. In other words, what you want to do is you want to maintain your body's own immune system to maintain the fact that the particular white cells that go after viruses stay in optimal mode. And there are many things. Now, high doses of vitamin C are one of them, but there
Absolutely.
are many other antivirals in nature that can help you. I would also look at things like beta-glucan. Are you doing that? Lactoferrin is another thing. And again, I use a lot of this in the hydration bags. I would also look at a couple of things like transfer factor. So come on in and see me for the free consult, will you? I would love to help you.
definitely will.
And
I
help
definitely will,
you.
Molly.
Yeah, you're a good man, and I know. And by the way, this is a terrible disease, and I think, thank God, we're in the 21st century, and we know this is treatable for the most part, and the most important thing is to maintain your health. Thanks for the call. That's it. Thanks for the call, Mark. This was a wonderful call and a great way to start the show.
Mark,
thank you.
thanks a lot for the
Thank
call.
you.
Appreciate it. Good luck.
That was a wonderful call because it fits right into what I'm talking about today.
Exactly. And you remember, we all remember.
We're old enough to remember when this was the scourge of the earth.
They said this was going to kill the population.
Yeah, right.
Remember
They told us COVID was
exactly
too. So look, guys, the bottom line, Mark is a smart guy, and anybody out there that has this, has to look at this for what it is. It is just another virus. Yes, there are some viruses that are more deadly than others, but if you maintain your immune system, I'm sure you can have a good quality of life. And Mark is a good case showing that he's doing just that.
All right, I know that we were talking before the show, you and I, and I know this because, I've been a patient for over 20 years. There's so much that you do in addition to hydration,
right,
or as part of hydration,
it's really
too.
part of hydration,
yes.
Because hydration is the quickest way for us to help somebody maintain their quality of life.
Right.
But it's not the only thing. What we're trying to do is we look at customizing all our treatment plans to include some of the other services that we do, and some of the other protocols that we do. So, for example, I have a light therapy instrument. Very, very important. Actually would be something I would probably want to use on Mark, because there's data to say using infrared, a laser type thing, might be worthwhile while also giving him hydration. Is that unbelievable?
Yeah, that is, yeah.
So that would be something. So we have light therapy. We have acoustical therapy. You know that. We also have the ability, one of the docs has the ability to mitigate pain by using marijuana. But we also use PRP, which means platelet-rich plasma. And gosh, we use regenerative medicine. I actually have a very interesting story about that for this week coming up. people who have cancer go to these other countries many times to get stem cells, okay? They can say that in other countries. Some states are more judicious in how we can talk about certain things, right? So obviously, I can't say everything we do on the air, John. I just can't do it because really it is a process that has to be medically supervised, which I have.
Yes, I know that. Yeah.
3. Hey, the joke is I want to call out to my friend out there John, who was a barber. In our place, it's 3 doctors, no waiting. It was 3 barbers, no waiting. But
true,
you know what I'm saying.
Yeah.
The point is we have to be very, very judicious in what we do talk about. But regenerative medicine is something we do, and we do it every day. So what I want to talk about today are lots of things that impact immune systems, one of which is cancer, right?
Yes,
Big one. It's a
yes.
big one, and I have lots of patients with cancer. So how do we monitor the cancer risk? And more importantly, we mitigate the modulation of the reoccurrence. How do we do that? Well, we do this in many ways. We do this, of course, taking the history and physical. We do this by looking at the previous cancer methodologies that they use, conventional, non-conventional, whatever. So when a patient comes to us, we want to review with them. We're very involved with our patients. But after that, what do I look at as the biochemist and the molecular scientist? I start looking at integrative type blood tests that are out there. If you've gone to an integrative facility for cancer treatments, we all know now that everything is being sent out from the biopsy in order for them to look at appropriate drugs to use on particular cancers. Well, that's the same thing is true for us in the integrative world. We would look at that. We might want to send it out to a special facility to look at it and see what types of natural substances would work on. So we have the ability to do that, John.
You are very big and have always been big on testing.
Yes, but I want to use it judiciously because
Yes.
I don't want to spend my patients' money in testing that's ultimately not going to be helpful to their protocol. So as much as I can use things from the traditional laboratory, we're going to. But we may look at that differently. We may look at some traditional testing differently than other physicians might look at it. And the good news is, remember, your blood work, your testing is only as good as your clinical. In other words, your clinical symptoms, what the doctors have to look at. What we do is we have a collaborative effort in our facility, which means the doctor is looking at you from the clinical area, right? God bless my medical director and my other physicians. They're looking at you clinically. And then we are putting together all the work that I do, that I look at certain testing. For example, we're looking at more sensitive testing for early detection. Because of my background, I was able to connect us with an American research laboratory that is doing something called liquid biopsies.
And we are coming up shortly on a break, and
Okay.
I want to get to that after the break so we
Okay.
can really spend a lot of time on it.
Okay.
But the thing is that you have always been big on testing, and you also, because of your background, have relationships with labs that
That's
other
right.
people may not have.
Or find the labs
right.
that are doing it and actually have their lab director discuss it with me. So that's really, and the thing is, that helps us eliminate some testing that's out there that we know really can't be used in a clinical setting.
All right, so it's so, you and I could sit here and talk for an hour about all the things you do besides hydration.
Right.
And how you help patients. But it's sometimes hard to work it all in and get people to understand it. But we're doing our best, and we're going to do that after the break. We're going to talk about liquid biopsy, and we'll talk about some other things. And, of course, we welcome your calls at 855-839-1210 if you have a particular medical situation, as you heard Mark did earlier. If you have any kind of a medical challenge, 855-839-1210 is the number, 855-839-1210. The show is Health Watch, Sundays 8 till 9, right here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and founder of Innovative Medical Associates, Marlton, New Jersey. And I'm your host, John DeMasi. We return with more of today's edition of Health Watch after these words. Welcome back to Health Watch. Operators standing by right now at Innovative Medical Associates. And the number is 856-489-0505. 856-489-0505. That's Innovative Medical Associates, Marlton, New Jersey. Call them, ask them a question, but most importantly, you hear Dr. Molly talk often about this, the initial consultation is complimentary, and that's really where you get a lot of good information, so that can help you make your decision as to whether or not you want to move forward. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, we have our Health Watch replay every Sunday, 4 until 5. So if you miss any of today's show, if you heard it, you want to hear it again, it's our Health Watch replay, Sundays 4 until 5, here on Talk Radio 1210 WPHT. This is our live version of Health Watch, and again, our number here in the studio is 855-839-1210. We mentioned, Dr. Molly, about liquid biopsy right before the break, and what are you talking about here?
In the case of liquid biopsy, it's a screening test for early detection. Now, it's one of many out there. And why do we want to use early detection? We want to use not just early detection, but we might want to use it as progression for checking on the progression of the disease. Suppose someone went through an entire course of chemotherapy. They weren't in our clinic or any of that, but they actually have to be followed from the non-conventional point of view. Now, again, I'm talking about the non-conventional point of view. You would follow them with a liquid biopsy or a cell search. So listen to the name, cell search. What are you searching for? You're searching for rogue cells in the blood to say, okay, there could be a potential for more progression. So that's some things that conventional doctors don't have time for. It isn't that they don't know about these tests. Oh, they know about them. They don't have time to sit with the patient and explain it to them, explain the results to them. I had 2 cases of that last week for 2 nice sisters who were looking at, they had done conventional treatment for breast cancer, which we applauded them for doing. We urged them to have the tumor removed. And what does Dr. Molly say? Get
the surgery,
out,
yes.
Right? Well, they went through conventional treatment. They came back to see us, and we then did the cell search because we were looking for the rogue cells. And that gives us a better indication of what I should be putting in their hydration bag. So doc puts that together, and then we look at what's right for the patient. There's an opportunity there. That's the best opportunity for early progression of the disease. So you may be able to knock it out before there is tumor.
I was just going to say, it seems to me
it's a good thing.
That this is a good thing, and that this helps you with early detection.
Correct. And so we know about early detection conventionally because why? We've seen all the molecular tests out there now. The Cologuard is one. Now, all of a sudden, that's everywhere. Right. 10 years ago, when Dr. Molly was urging my physicians to use it, and we did, it saved a couple of lives in our clinic. So what I'm trying to say is they're there. Everyone knows about CT and PET scans. That's conventional. But what we want to look at is other types of testing. We test for viruses. That's why I said Mark gave me a great call, because we found that a lot of our cancer patients, and we looked at the statistics, have certain viruses, whether it's CMV, which contributes to chronic fatigue, fibromyalgia, HSV 1 and 2, and others. So we look at that as a potential problem. And what do? We change up the drips. And by the way, I want to say something else. I had a guy come to me this past week and say, look, he waved something in my face. My conventional oncologist said vitamin C never, and here's why. Oh, great. We know that. What do you think I have 3 physicians on staff for? Because they know that. You don't give a patient vitamin C with certain chemo drugs. Because why? The chemo drugs are promoting the free radicals. Right?
Yes.
I'm pretty smart about this.
Right.
Okay, I am a biochemist, John.
Yes.
Free radicals. Okay, so we don't want to destroy the free radicals. What we want to do is give you many things that might help your own white blood cells go after the cancer. So there are many things. Vitamin C, although is a very big mainstay, and I know your favorite,
Yes.
it's not the only thing we use for the cancer patients. For example, in traditional medicine, you get certain drugs for certain cancers. Well, let me help you with that. In our clinic, that also is the case. We might use some things from that are very well known. We might use a subclinical dose of some other medications that have been around for the last 20 years and have shown by research that they have helped cellular activity for cancer patients.
Everybody's a doctor, you know that?
No, it was okay. No, they're not. I'm not a doctor. I am not a doctor.
You're
I'm the PhD doctor.
Right. But I'm saying everybody knows everything. Yeah, right.
Right. But the whole point of everything we do is to improve the quality of life, possibly slow progression of disease, all types of autoimmune disease, whether it's HIV. How about hepatitis C? Another one.
Yes.
Right? You know there's conventional drugs out there right now for it. 10 years ago, there wasn't. Okay. And I have a patient who we managed for 10 years to make sure that virus was very low, and now she's a candidate for the conventional drugs. Right? She wouldn't have been 10 years ago. She would have been suffering with this thing, and gosh knows how much liver damage she would have had.
So it's really, you've been at the forefront of a lot of things.
And we're moving ahead in that
Exactly.
direction again.
It's very interesting.
Well, John,
where you've been and where you are now.
Right. And here's another thing. Let's look even beyond that. So we look at hormonal cascades. And I'll tell you something like DHEA, which is a particular hormone that actually can limit your immune function. So we look at where are you in that? Is it in normal range? Is it high? Is it low? Okay, something. So then the doc sits and we look at the clinical data too. So you got to put it together. This is a puzzle. One part of the puzzle isn't more important than the other, but together it makes the full picture.
And that's really where you come into play as far as helping people get that full picture.
We try.
You know,
we try.
And that's kind of the point of the show today, that there's so many things that you do and that you have. It's like you're the guy. Remember the doctor when he used to come visit you with the house call? He had the bag, the black bag.
Right. What's in it?
You got the big black bag and a lot of things in it.
Well, what we try to do is look at everything. Another situation. Everyone knows melanoma, terrible condition, right?
Yes.
So the dermatologist, by the way, I work with a dermatologist on the skincare products, so believe me, he's in my ear all the time.
I know.
Melanoma is a deadly condition, right?
Yes.
Okay. Look at this. They run something called the GGTP. So if that's high, it's an indication that the melanoma has spread. Does it mean that the patient has a problem to the liver? Does it mean that they have tumor in the liver? Well, how are you going to find that out? You got to send them out now for radiology. So it's a combined program, but that's an alternative use of a particular test that even the conventionalists are using. That's my point. My point is what we do here, we have many tentacles. And as a result, we're able to put together a whole program for a particular patient.
It's not just hydration, as you just said. It's a whole program.
Right. And it upsets me so when I hear people spending hundreds of thousands of dollars running out to overseas, running to the West, out West, to all of these places to get their treatments when I know we can make the treatments cost effective and work well for a patient to maintain their quality. Can I say absolutely we cure cancer? Absolutely not. Absolutely not.
But you help.
We help people
Right.
feel pretty darn good, whether they choose a conventional route or a non-conventional route.
You know, not to criticize what people are doing, but
No.
I don't know about you, but I don't know that I would be completely comfortable going to Europe for any kind of medical thing. You know,
look,
it's possible, but
look,
I
let
wouldn't.
me tell you something. You know how I feel. There are a lot of good things that come out of Germany, Italy, France. A lot of good things. The question is, how are you using them? And you know, I have a lot of things in my black bag. And that's what I'm going to tell people. And can we help you? Yes. Actually, it's so interesting. In this country, they put a ban on something called wormwood. Wormwood has been known to help cancer. All right. Well, believe it or not, Dr. Molly found a way to look at wormwood that's really okay, it's allowed, in a drink. From Italy. It comes in every day to the Italian markets.
Yeah.
Okay. This particular drink comes in every day to lots of Italian markets. Well, I ordered about 4 or 5 cases of it, and I'm throwing it in the protocol for my people. My point is, listen, folks, you got to use your head. And it's quite tasty, by the way.
Yeah, a matter of fact, you gave me a bottle.
Because
I remember
of your
that.
situation,
Yeah,
right? But the point is, so it's outlawed here, but it's perfectly fine in Europe. Okay, well, if you want to spend $100,000 for the drink, go ahead. Okay, it would cost you $5 in my place. Okay. But I'm just laughing, John, about all of this.
Exactly, it is frustrating sometimes.
It can be frustrating.
Yes. Okay, coming up on our final break of the morning, which means you still have time to jump in with a question here for Dr. Molly. 855-839-1210 is our number here in the studio. 855-839-1210. Our show is called Health Watch, and you'll find us here every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. With Dr. Molly Fantasia, I'm your host, John DeMasi. Coming back, more Health Watch after these words. Welcome back to Health Watch. As always, operators standing by at Innovative Medical Associates, and they'll be there well after we leave you at 9 o'clock. The number is 856-489-0505. You can call right now, or if you want to wait till later on today, that's fine. They're there all day. 856-489-0505. Also the number during the week for Innovative Medical Associates, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good info on that, including info about the skincare products that we've talked about. So you can check that out as well. 856-489-0505 is the number. Don't forget, we have our Health Watch replay, too, this afternoon, 4 until 5, here on Talk Radio 1210 WPHT. A lot more to talk about, Dr. Molly. It always seems like we run out of time.
I know, John. You know, here's the thing. If I could get something across to people, I would say it's so important. It's probably in your highest and best good. When you get a diagnosis that really stuns you, whether it's an immune problem post-Lyme, whether it's chronic fatigue, fibromyalgia, any of these, HIV, the worst thing you can do is stay in inertia. Don't move. It means you're going to put yourself at risk to not have a great outcome. And I encourage everyone, you know that, everyone who comes through my doors, I encourage them to do something. Do something to help yourself. And here's the thing. We offer safe, effective treatments for this. When I say treatments, I will say protocols. The treatments are my doc's bailiwick, but our protocols are safe and effective for your quality of life. And together, between the treatment plan that my doctors write in the chart and what I do in terms of our protocols, we can give you your life back. And that, for me, is one of the most important things. When I hear my patients who have decreased energy, who can't get out of bed, who are depressed, who just have given up hope, my heart bleeds because I know there's always hope. I like to say there's always another bus.
Oh, absolutely. And there's been so many situations, and I sit in the clinic. I mean, I'm a patient. I sit there and people say, well, you know, I said, what's your story? Well, I have this and I have that, and I came here and I feel terrific.
I feel better.
You know,
right. Most of my patients want to work. I have a woman who I'm sending to my consulting oncologist. She goes to New York twice a month for conventional chemotherapy given a little non-conventional way. And then we do her entire follow-up here at my facility. And we do it by utilizing both conventional. She needed some iron at one point. We delivered iron. That's a very conventional treatment. My doc did it. She's a great gal. Okay? Yeah, she has some slow days, but I will tell you, actually, the other day I was speaking with my doc in New York, and he says, you know, Molly, we never give up, but she beats us. And that there's something nice about that. Right?
It's been 11 years since my major medical
remember.
challenge, and I had a tumor on the kidney, and Dr. Molly said, get the surgery, get it out, and we'll take care of the rest. And you have.
And I appreciate that. And I remember that I actually encouraged you to do something that was a little off label, and you did it at
Yes.
Penn. Do you
Yes.
remember that?
Yes.
You said, what the heck is this? I said, you know what? That's a great therapy.
Yeah.
Do it, do it, do it.
Yeah.
So, we're going to give advice, I think, and we try to give the best advice we know professionally. And again, we do not say stop your conventional treatment. But I have patients who don't want to do conventional treatment. Everyone knows Pam. Everyone knows her.
Yes.
She tells her story wherever she can. And you know what? God bless her. We did all of the testing in the past couple of weeks. She is so perfect. Thank God. We don't spit in the wind, as we like to say, but she's perfect. And why? Because she follows the lifestyle changes. She does. She comes in and sees us faithfully. And she doesn't miss a beat in terms of care, self-care.
And still cleans her own house.
Oh, yeah, among other things. I mean, she wants, listen, that's the point. And do I help kids? Do I help young men and women who are athletes? The answer is yes. We want them to be in tip-top shape. There is so much we do. You got to come in and see it for yourself. That's all I can say.
Yeah, and you had a young man the other day,
yeah.
and he was talking about, he's a delivery driver.
Oh, yes.
And he was talking about the other day, what was that one day we had, the hottest day of the year last week?
Yeah.
And he was working. He said, he worked like 14 hours or
That's
something.
right.
And you asked him, he said, I feel a little funny. Did you hydrate yourself? Yeah, I did, but he didn't enough.
But he really didn't
Right.
enough.
Yeah.
So I said, get in the chair. We're going to hydrate you
Right.
before you go out and do the rest of these deliveries. Don't tell the boss. Okay.
Okay.
But, these are the things, John.
Yeah. It's interesting, and that's why you've talked about the initial consultation, and it doesn't cost you anything.
No.
But and you had one the other day that, people just come in and they.
She was referred to me by one of the docs I referred to for traditional pain management. And he referred her to us. And this was a heartbreaking case. You can see she's living on Insure. You saw that.
Yeah,
She was bone thin.
I thought gee, I hope. Fortunately, it wasn't a windy day because I said she would be blown away.
5'8", I think, 5'8" or 5'9". She weighed barely 100 pounds, right? And I said, "How much of that Insure you drinking?" Well, she told me. I said, "Man, you need to be with us." And hopefully she's starting this week, because here's a good case that the conventionalist said, there's nothing else I can do for you. You have a GI problem that can't be solved. How about my other patient who owns the restaurants? God love him. Another GI issue.
Yes.
That couldn't be solved. He comes in faithfully. When he misses, he said he missed the day. He knew it. So there's merit to what we do.
Yeah, and that's the thing. And certainly you can come in and talk to patients, and you've done
Absolutely.
that. You've done
Absolutely.
that. And it really helps people understand. Because this is, and we always talk about
It's
this.
unique.
It's unique, and it's sometimes hard for people to understand because we weren't raised with this kind of.
No, we're raised with what? Please take another pharmaceutical. Oh,
Yes.
You need to get up in the morning. Here, let me give you an upper. You need to go to bed at night. Let me give you something to go to sleep.
Okay, we got about a minute, Jim. Can we get this in?
Yeah, let's do it.
Yeah, okay. Lana and Cape May. Lana, good morning.
Lana's my nurse. Hey, Lana.
Oh, good morning. Good morning. Good morning. Dr. Melly, I know we're up against it. I
Okay.
have a friend's daughter struggling with postpartum anemia. What do you got for me?
Come on in. Tell her to come and see it. Postpartum anemia. She needs her B vitamins. She needs her both. She needs to have several levels checked, including her iron level, right? Iron bonding, and several others. Tell them to come in and see me, will you, Lana? I'd love to give her a list. All right?
All right, Dr. Melly, and I will see you this week.
I want to.
Okay.
How's our boy doing? Good?
He's doing really well, Richard.
God bless you.
He's doing well. He'll be
Good.
home on Thursday.
Thank God. He's
Good.
a great guy.
Tell him we said
miss
hi.
Lucky.
Yeah.
Goodbye.
Tell them we said hi. Lana, thanks for the call.
Thanks for the call.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators standing by, and they'll be there well after we leave you at 9 o'clock at 856-489-0505, 856-489-0505. The website, InnovativeMedicalAssociates.com, InnovativeMedicalAssociates.com. And don't forget, if you missed any of today's show, check it out this afternoon. It's our Health Watch replay, 4 until 5, here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, we have our nurses, Jess and Crystal. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week. We'll talk to you next Sunday, 8 till 9, Health Watch. You're on Talk Radio 1210 WPHT. Take care.